diagnosis of a terminal illness brings with it a host of physical, emotional, psychological, and financial issues that one may find a challenge navigating. I'm Dr. Masi Korir, and this is Health Digest. In November of 1997, what Margaret thought was a bout of tonsillitis turned out to be a diagnosis that changed her life.
During the chemotherapy, my arm, changed the skin. Then you become darker, like charcoal. And I remember one day we had gone for a function. It was nyama choma type of. And one person told me, said, we need somebody to add charcoal here. And because you are already used to charcoal, just ideas.
10 years ago, she was again diagnosed with stage 4 of the disease. She says she's a living testimony of what a positive attitude can do.
Despite the fact that, as a very general principle, stage 4 cancer is incurable, there are stage 4 cancers that are curable.
Dr. Gladwell Kiarie is a consultant physician and a medical oncologist. She provides an expert take on stage 4 disease and why it doesn't have to be a death sentence. On Doctor's Diary, your everyday hero is Martin Moley. Martin was an untrained teacher for 4 years, but now as a nursing officer, he is the facility in charge at Mutulani Dispensary in Makueni County. Margaret Waweru, a wife, a mother of 3, and a grandmother of 2, has a lot to be grateful for. Margaret, a church elder, dedicates her days to the community, visiting and encouraging those living with cancer and their caregivers. Her calm demeanor is born of many years of triumphs and losses.
I felt a lump on my right breast. I thought it was tonsillitis, so they didn't shock me much. Went straight to the doctor. By then I was working at PCA Kikuyu Hospital as an administrative assistant. And on examination, I noted she changed her face. And I asked her, is it serious? She told me, I want to send you to mammogram. After mammography, I was taken a biopsy later. And the biopsy showed that I was stage 2B of the right breast. And so I was booked for operation, which I had to lose my right breast. Later, after surgery, I underwent chemotherapy and radiotherapy, and then later 5 years tamoxifen. And then life was okay.
This was almost short-lived. In 2010, Margaret started experiencing what she recalls as traumatic symptoms.
Because I was coughing day and night, I lost my weight, and the breath was hard, and things were not moving well.
She consulted several doctors about her new symptoms, but all seemed to have different opinions, which did not sit well with her and her family. They decided to face east and go to India.
After going through the PET scan, they realized there was problem of the other breast. And cause my talking, my voice was like losing. I couldn't hear. You couldn't hear what I'm talking about. And because there was a tumor at the throat. We had to work on the lungs and work on the tumor on the breast. For the neck and the diaphragm plus the throat, nothing was done, but I was promised that the medication will suppress the tumors. I stayed in the ward for 58 days, but a week before discharge is when the doctor broke the news that I am stage 4 of lung breast cancer. And so I underwent, after surgery in there, they did the radiotherapy, 30 sessions there again, and concurrent chemotherapy.
Later, she came back to the country and finished 6 more cycles of chemotherapy. Since then, her weight has gradually improved from 47 kgs then to 60 today. No mean achievement.
From that time, I'm on treatment. I do take my drugs, which I don't know for how long.
In retrospect, her first cancer diagnosis was a lighter load compared to the second diagnosis at stage 4 of the disease.
It was also more expensive than the first one, because I remember the first one I used like for about 400,000, but the second one, for me to get to India and come back, I used like 3 million. That was a lot of money, and you know, it is to manage it. Even today, I'm still using.
Margaret's experiences while undergoing care at various stages of her cancer diagnosis have been traumatic and painful to recall.
For one, I remember when I was diagnosed, I thought I would die. My children will stay without a mother. I was feeling for my husband. At the same time, before I die, I would feel for myself. A lady staying without one breast. You know, I would see, and I remember, because I stayed without knowing there's a prosthesis that can match the breast, I would assume that everybody's looking at the flat breast, and that one causes stigma. The other thing I remember that caused stigma is during the chemotherapy, my arm, changed the skin, then you become darker, like charcoal. And I remember one day we had gone for a function. It was nyama choma type of, and one person told me, said, we need somebody to add charcoal here, and because you are already used to charcoal, just ideas. I remember I was on wig one day when I was in a matatu, and my wig just hung through the matatu entrance, and I remember the matatu tout akaniambia, mama, umesahau kichwa.
Now she can afford to laugh off any such comments, but it has been a steep learning curve. 10 years with stage 4 lung breast cancer has taught her a lot.
When the doctor says this is what you're supposed to take, then you're faithful. And the other thing is, you should, if you are the first patient, you're the first therapist on your own. So if the problem is diagnosed, then what else can you say? If the doctor tells you it's cancer, you cannot translate it to diabetes or something. The psychological state in how you welcome the information, it matters. Just for the mind to hear cancer, to them, to some, it is death. And so some of them just go within a very short time. So it depends on how you take it.
In all this, Margaret has come to understand all too well the value of support from close family and friends.
My husband, from the word go, he has been quite supportive. And I think, as I say this, even the surrounding environment and people who know him, he has really been supportive. Because at times you come like, That time you couldn't even do things on your own. And he's taking care of you, everything. My children, and by then they were young. And as they grow, they understand Mom is not the same as before. She used to go to the shamba, do a lot of work. Today, I can't do that much of work. They've been quite supportive. Our family members, both where I'm married and where I come from, they've all been supportive.
23 years of a cancer diagnosis, the last 10 of which are of stage 4 of the disease, Margaret still encounters difficulty despite learning a few tricks, particularly on what she eats, to help her cope.
Though I've not been working as hard, because at times even, dusting the house the way I used to, I feel today I breathe hard, not like before. On the diet, I've tried as much to be on the diet. Vegetables, fruits, yeah. And then you rationalize between carbohydrate, the vegetables, and the proteins, you see.
After her experiences, Margaret now focuses on encouraging others diagnosed with cancer, regardless of age and sex.
After winning the race of this battle, I thought it's good to put those ailing together, the victims. And when we meet, we give encouragement to one another. We call ourselves Cancer Survivor Africa. You know, the way you can talk to a person and then tomorrow she tells you, I am fine because you talk to me. You gave me hope. You gave me encouragement. You know, that one, I feel I have fought the good fight and I've fought the race.
So what do we mean by stage 4 disease, especially now that we are talking about cancer?
Staging of cancer basically means description of disease extent. We have 4 basic stages of cancer. Stage 1 representing early disease and stage 4 representing late disease. Now, stage 4 cancer basically means that the cancer has spread from the primary site to a secondary site. It's a very generic term because all stage 4 cancer patients are not similar and their prognosis is also not universally similar. Now, despite the fact that as a very general principle, stage 4 cancer is incurable, there are stage 4 cancers that are curable, either because the volume of disease is minimal and we can be able to do metastectomies and remove the metastatic lesions, or, basically incurable, where we use palliative treatment or terminal care. For example, if I say that this patient has stage 4 breast cancer disease, it may be stage 4 because they have a primary breast cancer and they have one solitary lesion in the bone. Now, they will be classified as stage 4 cancer with another breast cancer patient who has metastatic lesions in the liver, the lung, the brain, and even bone. So if you look at the volume and disease extent, the 2 patients are not similar. Now, when we have what we call oligometastasis or single metastatic lesions, sometimes we can be able to remove them, ablate them or radiate them, sort of quote unquote curing the patient or giving them a very long disease-free period. Hence, that would be completely different from a patient with stage 4 high volume disease and multiple metastatic sites.
When a diagnosis of end-stage disease is made, sometimes people are told that you have 3 months, you have 6 months. What parameters do you use to tell somebody that this is how long you have to live when they have such stage of a disease?
We do have what we call survival calculators. So I may know that you have colon cancer, it's stage 4, it's this grade, this number of nodes are involved, you have these metastatic sites in the liver. But even with stage 4 disease, there are multiple factors that will cause variable survival. For example, you may have 2 patients with stage 4 cancer. One responds very well to palliative chemotherapy and the other does not. So you find the type of disease that responds to treatment. And also in types of cancers where we have variable, different, many opportunities to treat using different modalities, patients survive longer.
What do people understand about end-stage disease? When you tell somebody that now they have stage 4 disease, what are some of the myths, the misconceptions that people have about this?
I think the worst thing one can do after being told they have stage 4 disease is to generalize. As much as in a general principle stage 4 cancer is incurable, it's very important to get staged correctly so that you're very clear about the volume, the extent, and what are the risks or great threats of the disease. For example, if we say that stage 4 cancer is incurable, we know people with colon cancer who have single or very few metastatic lesions in the liver may be cured after chemotherapy by doing metastectomy. So the label that stage 4 cancer is equal to death may not be correct in that sense. Now, some people realize they have stage 4 disease and think that they have a very short term to live. Now, we do palliative treatment for even stage 4 disease that is incurable and prolonged disease-free periods for stage 4 cancer patients. So we may use chemotherapy, we may use radiotherapy, targeted therapies for prolonged periods of time to contain the disease, to give them a good quality life, whereby these patients with stage 4 cancer continue to live ordinary lives. Sometimes it's even hard to tell that they are sick, and we're able to prolong their survival and give them a good quality life. Another myth about stage 4 disease is that alternative treatment will cure it. And many people, out of desperation, go to look for other alternative treatments like certain vitamin infusions. They'll go for some of this radio wave treatment. They go for all manner of things. You remember the story of people flying to Tanzania to go and look for alternative treatment. So it is a myth that alternative treatment can cure stage 4 cancer. Now, several aspects about quality of care, for example, control of pain, the issues of nutrition, emotional and physical and spiritual support are all very important in the care of the patient with stage 4 disease. And it is a myth that nothing can be done to a stage 4 cancer patient. There is evidence that if you improve, you control pain, you control some of these symptoms, you may prolong their life and offer them a good quality survival. There is also a myth that if you stop eating red meat and drinking milk, you shall live longer when you have stage 4 disease. So there are a lot of myths related to nutrition. Sometimes people think that prayer and spirituality does help in bringing comfort to the patient, but also, certain other alternative aspects of trying to cure the disease may not necessarily work.
What exactly does palliative care and end-of-life care involve when managing somebody with a stage 4 disease?
There is what we call for a stage 4 cancer patient who we deem incurable. There is palliative treatment. Now, palliative treatment may go on from weeks to months to years. There are patients on palliative treatment who live for years. Their survival is years. Now, palliative treatment, therefore, also does happen to patients who are on chemotherapy or radiotherapy to control their symptoms, to buy them time and prolong their survival. Terminal care or hospice care, on the other hand, is care given to patients where active management or treatment has been stopped because it is not useful to the patient, and 2, it may cause toxicities that can terminate their life quicker than the disease would do, and basically it's sort of the end of the journey. So that's when we do hospice referrals and also talk about what we are calling terminal care, where survival is usually days to weeks. There are variable parameters that range from the type of disease, some cancers are more aggressive than others, to the disease stage, the volume of metastatic lesions, the effect of this stage 4 disease on organ function, vital organ function, for example, on the brain, in the lungs, in the liver, in the kidney. So if the disease has affected organ function, for example, cause renal failure or liver failure or respiratory distress such that a patient needs to be on oxygen support, all these are parameters that we use to say that no intervention may be helpful. Sometimes the disease extent is so advanced that any intervention you may give, however helpful, has no time to make a difference. And that's when we say sometimes initiation of treatment may have come too late. On the other hand, there are patients who come and already the disease has caused organ failure that deem them untreatable. For example, some drugs we give need vital organs to metabolize them and digest them. If your kidneys are not working well, or your liver is not working well, or you can't breathe properly, or your heart has failed, it is impossible to treat you. So some of those parameters guide us to make a good balance about who not to treat and who to treat. The principle and ethics of medicine dictate that a doctor should never make a bad situation worse. So sometimes we accept that this is the end of life, that intervention is too late, and sometimes death is inevitable. We do have very difficult discussions with patients, either who have been treated previously and have gotten to the stage where they do not respond, or patients who've been diagnosed too late and no treatment can be offered. Sometimes we have very difficult discussions with the relatives, the next of kin, the patients themselves about what we deem futile care. And one of these examples, Dr. Coril, is, for example, when we know a patient is terminal, we do discuss whether they'll need ventilatory support or ICU care when this time comes. Because sometimes putting them on a ventilator, that is artificial respiration or breathing for the patient, will not be helpful at all because the disease they have is completely irreversible. So it is unethical to put such a patient on a machine where you know you'll never get them out. Eventually their heart will stop, and all relatives do is incur bills that were futile or not necessary. So it seems it is not within our culture to discuss death, but in this day and age, ethics dictates that we should discuss everything with the patient, the next of kin, and the relatives, so that we make decisions collectively about the care of their patient. There are patients who make these decisions before that stage comes. They say that when I get to this stage, I do not want to be put on futile life support, and therefore it's very easy when it comes to that. In the ethics of medicine, once a patient is on life support, you cannot withdraw it according to our legal system. Euthanasia or mercy killing is also illegal and unethical in our culture and also in the laws of Kenya. Therefore, we try and make decisions before we get to the machine. Once we've intubated or ventilated a patient, we cannot withdraw. Sometimes when patients become brain dead, and we do certain tests that clearly show, they're called caloric testing done by the neurologist, that show the patient is vegetative or brain dead, then we can have de-escalation of the machine until the patient's heart stops. But this is quite rare. Most of the time, with good medical consideration and where we've taken care of patients for long, sometimes these decisions can be made before. Then you don't have to do difficult things like extubating the patient. That is usually not acceptable. In the event that a mistake has been made or relatives did not reach a decision or consensus, and we ventilate a patient we think medically cannot make it, we usually push on until the end. and eventually such patients will have a cardiac arrest on the ventilator. We lose them anyway, and sometimes there's a big ethical question about what necessitated that futile care. But the principles are that human life is sacred, and all that should be adhered to as you're making these decisions. It is not one caregiver or one medical doctor who makes the decision. We usually involve a multidisciplinary team